heart rate at all, guys. No heart rate at all.
Okay, let's get them off.
We try to create an environment by which we can do drills with our staff and to recreate very, very high stressful situations. We have this program, we started it about 2 years ago or so, and we do quarterly drills. Well, in the drills, we attempt to recreate perinatal situations, babies in distress, mothers in distress, and we put our staff into those situations.
We videotape the whole mock code, and then when they watch it and they see actually themselves make a mistake and we don't point a finger at them, then they don't become defensive. They process it, and then they're able to admit, you know, oh yes, I could have done this better. And it makes it such a, I think, more impactful for them so that they actually will go away from that doing things totally differently the next time around.
Initially, we had to get over the camera, you know, and then seeing yourself, you think, oh my gosh, my hair looks like that, or oh, I didn't know I had this kind of habit that I twitched or put my, you know. And then once we got over the initial ego part of it, you know, it became real. You could really put yourself in real time. And the simulated doll became a baby.
You need to call the NICU and tell them that we're going to have a very, very sick baby.
Then the next thing you had to get over was, will I look like a failure, you know, to my peers? You know, will I make a mistake? And, you know, under these simulations, you know, you do, and it's a great learning process.
This is a 3-kilo baby, so he should be at what?
About 9.
Okay, good. Perfect. Listen.
I know for sure we had problems with medication errors like every hospital does, and we've seen a huge improvement in that with doing our mock codes. Our nurses pretty much relied on the physicians or the nurse practitioners to know what dosages medication should be, and in a code situation, you know, feel like they should just give what the doctor orders. And now our nurses know, and we actually have lots of tools for them to refer to, but they will question a doctor. You know, we've had that happen in practice, that they'll question a doctor if they're unsure about what the dosage is, and they know their dosages now. So it's been really awesome to see that.
We actually ran a drill about a year ago that had the physician give a wrong dose of medication. And about 50% of our teams that were participating in those drills, there was about 18 drills, about 50% of them gave the wrong medication, did not challenge the medical person, neither the neonatal nurse practitioner or the physician, the neonatologist, in the dosing. A year later, or about 6 or 7 months later, we redid the drill. It wasn't the same drill, but it was similar. Again, the medical person gave the wrong dose. Or ordered the wrong dose. 100% of our teams at that time challenged the physician, took the drug sheet that was right beside the patient's bedside and said to them in a very non-emotional manner, "Doctor, I think that is the incorrect dose." It gave them that confidence by having practiced that whole scenario.
I think the drills are important because they help reduce errors in real practice.
No matter how long you do it, whether you're a nurse for 2 years or 20-something years, you still have that you know, that confidence that you need to work on, you know, build on, so that you're doing what is the standard of care.
Okay, let's stop the drill. Good job.
I'm actually making a difference here and you know, educating our staff and bringing about some change. So I do definitely feel like that this is very rewarding, yes.